Hello friends, a very warm welcome again. Today as a part of this series we will be discussing about breast cancer. October is celebrated as Breast Cancer Awareness Month. Why it is important is because breast cancer is one of the cancers which, if detected in time and treated appropriately, gives long term survival. And by this long term, I can say with confidence it can stretch over 10 years in a large majority of our patients. So, I show this slide very often, and why it is important is it gives a glimpse of the cancer burden that India currently has. And if I may put it simply, 1 in 8 Indians is likely to develop cancer in their lifetime. That's an alarming number. And the number of cancers that are growing at a very fast pace in this country need more and more awareness so that they can be caught and treated in time. So, amongst all cancers, breast cancer, cervical cancer, that is the cancer of the uterine cervix, remain the important cancers in female. Included others are significant others are colorectal cancer and oral cancer, which is peculiar to the Indian population because of the habit of consuming tobacco in its various forms and is hence largely preventable. So, the breast consists of mainly fat tissue, but it also has glandular tissue, and this glandular tissue can be segregated as the lobuli and the ducts. So, lobules are the seat where milk is formed and it is carried through the ducts. There are various multiple ducts which eventually all culminate at the nipple. For clinical examination purpose, medically, the breast is divided into 5 quadrants, which include the outer upper quadrant, which is the site of most of the benign and malignant lesions of the breast. So, this the world map, which is by Globocan, and you can see all these dark blue areas are countries where breast cancer incidence is extremely high, which includes North America and Australia. India is somewhere in between, although the incidence of breast cancer here in our country is rising at a fast pace. Overall, there are estimates that 1 in 22 women in urban India will get breast cancer in their lifetime. It's really alarming. So, what we know about the risk factors for this disease? It's common in female, but that doesn't mean it doesn't occur in males. Males are rarely affected, although in less than 1% of all the breast cancers that happen. But nevertheless, male breast cancer is a possibility. Then there are certain age related factors. Breast cancer peaks in India around 45 to 50 years, which is a decade earlier than what is seen in the West. And if there is a hereditary transmission in form of some genes which are known to cause breast cancer, such as BRCA1 and 2, then a strong family history is usually present, and like their mother, grandmother, aunts all have either breast or ovarian cancers. That is how we do the genetic screening, and in the history at least, and if positive, then further genetic counseling and genetic tree is mapped. Amongst other hormonal factors that affect a female, including early menarche, late menopause, consumption of hormone replacement medications or oral contraceptive pills for a long duration of time. But the most important factor is now the lifestyle factors, which is a sedentary lifestyle, consumption of high amount of tobacco products and minimal exercise, alcohol, type 2 diabetes, etc. Now, these are largely modifiable risk factors. So, what are the presenting symptoms of breast cancer? There can be a small painless lump in the breast, and in advanced stages there can be overlying skin changes in the form of an orange peel appearance, right, and there can be a change in the size of the breast. The nipple can show certain features such as bleeding from the nipple or cracked nipple which seems indrawn, as you can see in the patient's photograph on the extreme right upper corner, or there can be glands in the armpit. So, any evaluation of a suspected breast lump will include a clinical examination by a qualified physician, some amount of breast imaging, which can be either an ultrasound or a mammogram. Now, one thing to be stressed upon is that a mammogram is generally advised if there is a high degree of suspicion or for screening purpose, and it's usually done in ladies over the age of 35 to 40 years. Generally, there is a tendency where people do prescribe a mammogram in very young females, where it becomes extremely useless because the breasts are dense and picking up anything inside the breast is practically impossible, and the patient is exposed to unnecessary radiation. Although the amount of radiation in a mammogram is less than what is experienced while getting a dental X-ray done. So, it is pretty harmless, but nevertheless if it is unsuccessful, it should not be done. Now, the third would be a histopathology, which could either be a core needle biopsy or a true cut biopsy or a FNAC as per your doctor's evaluation. And what is basically done in a biopsy is that under local anesthesia, a small amount of tissue is obtained from the tumor using a wide bore needle. It is like almost a painless procedure done as a routine in the OPDs. And depending upon the stage of the disease, the breast cancer can be broadly classified as upfront operable, locally advanced or metastatic. Metastatic implies that the breast cancer has spread from breast and the armpit to the rest of the body somewhere. Management of breast cancer essentially includes 4 arms, and they are actually 5 now, including surgery, radiotherapy, chemotherapy, hormone therapy and targeted therapy. And surgery, you must understand that it addresses not only the breast but also the armpit, where cancer is most likely to metastasize in its first step. Again, surgery for breast may include removal of the entire breast, which is called mastectomy, or a breast conservative surgery. Management of axilla is nowadays a hot topic, and minimal is the role. So, if there is no apparent gland in the axilla, we can do something called a sentinel lymph node biopsy. As I was mentioning, there are procedures now available with some amount of plastic surgery, which is called oncoplasty, wherein the entire breast need not be removed, and we remove the tumor along with a little bit of normal tissue so as to attain negative margins. So, it does not mean that if one has a breast cancer diagnosed, the lady is going to lose her breast. There are various modalities and reconstruction methods available where a mastectomy can be totally avoided, or a plastic reconstruction, reconstruction using plastic surgery is possible. So, in situations even though a mastectomy is required, there are various methods to reconstruct the breasts, either with the help of a saline or a silicone implant, or with the help of various kinds of tissue transfers, which are generally done with the help of a plastic surgeon. How do we prevent breast cancer? Primary prevention is not possible, but there is something called screening, breast cancer screening. In India, we do not have any definite guidelines on breast cancer screening, but what we can essentially do is breast self examination. In advanced countries such as in the US and UK, there are definite guidelines of mammographic screening for females above a certain age group. And then there are interventions called the risk reduction interventions in patients who are extremely at high risk of developing breast cancer, such as the ones with a positive genetic mutation. So, what is done in a screening mammography is that the breast is gently compressed in between 2 plates and a low voltage X-ray is applied through the breast. Any subtle abnormalities in the breast, various kinds of calcifications etc. are easily picked up and reported. So, that is how a breast cancer, which is still very at a nascent stage and is not palpable, are frequently diagnosed with this method. In India, it is not feasible and neither it is practical because of its huge population that would need to be covered, and also we do not have that high incidence of breast cancer fortunately in our country as yet. Some of the guidelines that are prevalent in the West, such as breast screening, is currently offered to women aged 50 to 70 years in England every 3 years by the NHS, or in some places age 45 to 54 annually. What we all can do at home is something called a breast self examination. It is a very simple procedure wherein the breast is examined with the flat of the hand. One thing to remember is that breast should never be held in between the fingers and the thumb. whenever you hold a breast between your fingers and the thumb, it will always feel some nodularity, which is normal, and in aging population there might be a little more significant nodularity, which essentially is harmless. The best time to examine the breast is after your periods, when breast is nice and supple. Now, I mentioned about risk reduction interventions. These interventions essentially can either be surgery or it can be certain medications, and usually surgery, it's something called a prophylactic mastectomy, is advised in patients who have BRCA1 or 2 mutations, which are specific genes which increase the chances of having breast cancer in the patient, in the healthy person who has these mutations to a significant degree. Now, this is a famous Hollywood actress, I am sure all of us know well about her. She is extremely talented, but unfortunately she was a carrier of this harmful breast cancer gene mutation. Her mother and aunt both died of breast cancer, and hence she decided to undergo a bilateral nipple sparing removal of the breast or the mastectomy, and her breasts were reconstructed using an implant. Now, prophylactic mastectomy, when you remove the breast where there is no cancer as yet, will not decrease her chance of developing breast cancer to 0, but definitely it will decrease the chances of developing breast cancer to an extremely significant degree. So, that is how this prophylactic mastectomy helps certain individuals. So, that is all regarding breast cancer. In the next series, we will be discussing some other breast lumps which are not malignant per se, but they are found commonly in general population in females, and we will be discussing how to differentiate them from breast cancer. Till then, thank you for your patient listening, and take good care of yourselves. Bye bye.